morning, everyone, and welcome to the Grandparents Raising Grandchildren What to Know webinar. It's graciously funded by a grant from the Community Foundation of Middle Tennessee. Our panelists today are myself. I'm Paula Daigle. I'm with AgeWell Middle Tennessee, formerly the Council on Aging, and I'm the Community Engagement Director. And Carissa Lynch from Family and Children's Service, who's the Director of their Relative Caregiver Program. And Kanetta Harris, who's with Family and Children's Service as well, the Mid-Cumberland Supervisor for their Relative Caregiver Program. So just to give you guys a little bit of background about AgeWell, we were the Council on Aging. We're a trusted community resource for over 38 years. We have a helpline that calls for older adults, caregivers, professionals to give information and assistance for issues regarding aging and how to care for your loved ones. We have several guidebooks that are available to the public free at our office. We also do scam prevention workshops and a scam of the month email. We have an online navigation tool called Rubric to help caregivers who are caring for aging parents or older loved ones. And we also produce the Directory of Services, and those are our guidebooks. If you are, as an older adult or a professional or a caregiver and in need of assistance of caring for an older parent or an older relative, not a child, which we'll talk about in a moment, just let us know. We are available free at our office, and give us a call and we'll be glad to get those to you. So to tell you next is a little bit, I'm going to turn it over to my friends from Family and Children's Service to let them talk a little bit about our topic today, Grandparents Raising Grandchildren, and a program that is run by Family and Children's Service called the Relative Caregiver Program. So I'll turn it over to them.
Thank you, Paula. My name is Carissa, and I'm the Director of the Relative Caregiver Program here with Family and Children's Service. And we are a nonprofit, and we have a contract with the Department of Children's Service. And it's a great state-private collaboration where we can work together and serve families. And I just kind of want to give a little bit of history about the program. Sometimes parents just aren't able to care for their children. A lot of times it's due to substance abuse, mental illness, sometimes homelessness, incarceration, or death of a parent. So really in Tennessee, there's 7% of children who are not living with their parents. So as of 2021, there were 108,000 children who weren't able to live with their parents. And 5% of the total number was living with their grandparents. So the program really developed from the recognition that children do better when they stay with their family system. So if they can stay in their communities, stay with family members that they already know, they just have better outcomes. We're really just trying to keep kids out of the foster care system. So in 2009, the state legislation just looked at the needs of the community and just realized these relatives who were taking in the children didn't have a lot of supports. So they started a 2-year pilot, and it was so successful, and really they were just helping meet the needs of the families, because sometimes these families would take in the children and then not have any resources. They didn't get foster care, so they just kind of were stuck in no man's land. So as the program was successful, they just expanded to more regions, and so now there's a program in every county in Tennessee. So there's 8 different providers that cover this program in Tennessee. And Family and Children's Service, we've covered Davidson County for 20 years. And as of January of this year, we took on 12 additional counties in Mid-Cumberland. And these are the counties that we serve: Cheatham, Davidson, Dixon, Houston, Humphreys, Montgomery, Robertson, Rutherford, Stewart, Sumner, Trousdale, Williamson, and Wilson County. So I just want to go over the eligibility requirements. To be eligible for the program, you have to be a relative that's related to the child by blood, marriage, or adoption. So it could be grandparents, aunts and uncles, cousin, and sometimes it's older siblings as well. You also have to have primary care of the child. So the child has to, be in your care. And sometimes that's formal arrangements, like DCS has removed the children and have placed them with the relatives. And sometimes it's just an informal arrangement. There is an income limit. So families need to be under 200% of the federal poverty guideline. And the other requirement is that the birth parent cannot live in the home. So we do offer a lot of services. We do a lot of information and referrals. Sometimes caregivers need to know how to get connected to the SNAP program, food stamps, or how to qualify for housing. There's also Families First Child Only. So we do a lot of information and referrals for our clients, and a lot of that is just case management. We do home visits. So each family is assigned, we call them family advocates, basically a caseworker, and they make monthly in-home visits. So it's really a way that we can assess needs and just make sure kids are living in safe and stable homes. We also offer, I'm sorry, I skipped a line there. We do offer emergency financial assistance. So if a caregiver needs help with rent or utilities, we can cover that. Another big part of the group is we have support groups and enrichments. So every month we'll do something fun for the families. Like we've gone to pumpkin patches, we've gone to trampoline parks. We really just try to find fun activities for families to do and just give caregivers a little bit of respite when we can. The newest part of the program, which this is exciting, actually, I'm going to let Katie, Kanetta is on the line with us, and she is going to talk about the newest part of our program, which started in January of this year.
Hello, I am Kanetta Harris, and I also go by Katie, but I am the supervisor for Mid-Cumberland. And like Carissa stated, we have an addition to our program in 2022. State legislators, they passed the bill allowing our relative caregivers to receive a monthly stipend. And to be eligible for this stipend, I'm sorry, I skipped a bullet point. Currently, the stipend is $16.88 per day per child that the caregiver has, and roughly that's about $500 per month per child. Now, in order to receive the stipend, the caregiver must meet the requirements of the program. In addition to being, the caregiver must be 20 years or older. They must have a final court order, and then they also have to be willing to seek and agree establishment and law and enforcement of child support. Now, if the caregivers are already receiving Families First, that is something that they have already agreed to seek child support. So usually that's not a big thing. However, they have to meet these three requirements. There are no waivers right now for the stipend. So if they are eligible for the program and then also meet these three requirements, they are eligible for that stipend. And just to remind you all again, it is $16.88 a day per child. And if anyone likes to make referrals, you can either email our referral inbox, which is rcpreferral@fcsnashville.org, or you can give our intake specialist a call at 615-340-9725. However, I know that we have went over the requirements. If any reason that you feel like that there's a family that might qualify or a family that's even interested, please just reach out to us, and then we can determine if that family is eligible or not. Thank you. Do we have any questions?
Feel free to add any in the chat to our attendees if you have questions, but I did have a couple of questions I'd like to ask. You mentioned Families First. Can you explain a little bit about what Families First is?
Sure, I can go over that. So Families First is a cash assistance program through the Department of Human Services, and a lot of families get it when they're not able to work. It's time limited. So it's kind of to help with gaps in employment. There's a certain kind of families, it's called Families First Child Only. And so a lot of the clients in our program received it. And when they look at that criteria, they only look at the income of the children. So it kind of helps caregivers who might be working, they can still receive this cash every month. And it is strict criteria. You do have to prove relationship. You do have to provide birth certificates. So you do have to be able to go through all of that process with the Department of Human Services. And I think it's definitely a smaller cash amount. I want to say it's like maybe $200 for the first child, and then it's like maybe 60 for each additional child. So it's not a lot, but for working families, it does help. I mean, raising kids is expensive, and there hasn't been a lot of support. And having a final court order sometimes just takes a while. So a lot of families have been caring for kids, and if they don't have a final court order, they're not able to get the stipend yet. So we really just, any way that we can refer families to have supports, whether that's if they qualify for SNAP benefits or if they qualify for families first child only, we definitely just want to help put in as many supports, you know, for grandparents taking in grandchildren. I mean, some grandparents thought they were retiring, you know, they had this whole plan of what retirement was going to look like. And then they get the phone call of, hey, can you take in these 3 children? And then there's just, it's a whole disruption to life. And it's really a sacrifice that our clients make when they take in relative children. And, you know, we had a caregiver appreciation dinner here last night at our office, and we had well over 250 people here, and just seeing the range of ages and just families coming together. They really are truly unsung community heroes, and that they're keeping kids and their families, working to return kids to the birth parents when it's possible. And it's really great that the state has this program. And we've been able to help a lot of caregivers cover rent and utilities. We're able to buy beds for children, clothing, school supplies. So really just fill in the gaps when all of a sudden you get a call and you have kids, and, you know, some people don't have rooms or furniture. So it's great that we're able to support them.
So we have a comment from a question from GNRC. Can you share with participants about your partnership with GNRC, which is the Greater Nashville Regional Council, and their Family Caregiver Support Program?
Yes, GNRC we've had a great partnership with them, and they provide funding for caregivers over the age of 55 to send children to summer camps, to pay for daycare and aftercare, and for tutoring. And so it is a great program. I love sending kids to camp. It gives the caregivers respite. The kids have a great time. I've sent kids to overnight camp at Camp Widgiewagon, and they do horse camp. And really, even with COVID, being able to connect children to tutors really helps fill in the gap. So it is great to have this funding that that GNRC provides, really just to help our older clients be able to do that. As we know, daycare in Mid-Cumberland area is a crisis. And I've talked to caregivers who have emptied out their savings trying to pay for daycare. So it's hard to find, it's hard to pay for. And when we can utilize this funding, it really helps stabilize the clients.
And in addition to what Rachel was stating in the comments, no, to receive GNRC funds, it is not an income requirement. However, for our program, it is an income requirement. And we have assisted grandparents in the summertime, sending those grandparents that don't qualify for our program or not really interested in our program, but would like to receive GNRC funding. I mean, and like Carissa was stating, we have sent those kids to summer camps. So just to clarify, no, you do not have to be, there's no income restriction to receive GNRC funds.
My next question for you guys is, what if I'm a grandparent out there? I don't know if I'm going to qualify, but I'm a little overwhelmed. Can I call you to ask questions or to just get advice? Do you guys assist people maybe who don't fit the requirements of the relative caregiver program?
Well, I would say definitely yes, go ahead and call. Our intake specialist, her name is Dewartha, and she's fabulous. I mean, she works with people. We don't ever turn away anybody empty. Even if you don't qualify for this program, we would help direct you to resources in the community and help you find what you need. And there's so many services here at Family and Children's Service, getting connected to health insurance, there's counseling. There's several programs here where most likely we could direct you to another place. So even if you're not sure, if you're thinking about you might need to be taking children in, or if you know someone, definitely still call, and we can determine if you're eligible, and if you're not eligible, we still would have resources that we would love to help support people with.
What if I'm a professional, say I work in the school system or at a daycare or maybe a coworker, and I see they need help? Can I call you and say, how do I help this person? What do I do to get information? If I say I'm a social worker at the school or a counselor, what do I do?
Absolutely. Can I take this question? Absolutely, you can. For anybody that you see, even if you have if it's a next door neighbor and you want to make the referral, as long as it's okay with the caregiver, just stating like, hey, I want to refer you to this program, and we can give them a phone call. This is a voluntary program. So if we give them a phone call and explain our services and what we have to offer, and they say, no, we're not interested, that is perfectly fine. But like I stated before, just send the referrals to the email that was listed or the phone number. So no referral is a wrong referral.
I like that. Very good. I'm not seeing any more questions, but my final question is Family and Children's Services recently took over those mid-Cumberland counties. What future plans do you guys have for the expansion into those counties?
So we are looking for an outreach person that also will take on other responsibilities, but just getting the word of mouth, just getting out there, going to different community partners, sitting on different boards, just to get our name out there, get the word out there that we are under a different agency, and are willing to go into those communities where they are under served.
Okay, great. If I don't see any more questions, again, I want to thank you guys. Wanted to talk a little bit about a book that AgeWell has for grandparents and for those caring for grandparents or grandparents caring for grandchildren. It's a guidebook called Empowering Grandparents, a guide for grandparents raising grandchildren. It was put together in 2014 by a committee, which Family and Children's Services were a big part of. And it's a one-stop shop. It can be very challenging raising a grandchild. And we've recently updated the book. It has everything from legal questions on how to adopt, how to get custody, who do you call? Working with schools, it can be very difficult for a grandparent to go into the school system and know who to call. Things are very different maybe now than when they raise their own children. There's information about health, a great section on technology. And it's a free guidebook. We're in the process of getting it. It's updated and printed, and it'll be available in January of 24. And Family and Children's Service will have copies, and we will have copies at AgeWell. So if you're interested, make a note and call us back in January. You can stop by and pick some up. We're happy to make a delivery to share with you because it's such a great guide and great information. So we're glad to share with you. Again, we want to thank the Community Foundation of Middle Tennessee for their generous funding of this webinar. And I want to let you know Family and Children's information one more time. So if you do have questions about the relative caregiver, even if you don't know someone or you're an educator and you're curious about it, please give them a call to learn more, to get more details, maybe to get advice on a situation. There's such a great team there. And I thank both of them for joining us today on this webinar. And we will have it on AgeWell's YouTube in a few days. So if you have folks that couldn't come and join us today, please have them look on our YouTube. And that's going to be on our website at agewelltn.org. And again, if you're an older adult or you're caring for an older adult and you need some assistance, we're your go-to agency. We have our helpline and our website with great information. So again, thank you all for joining us today. And if you have questions, please feel free to reach out to myself or to Family and Children's Service, and we'll be glad to help you as you care for those grandchildren or relatives in your life. Have a great afternoon. Thanks for joining us.